Thank you. Mr. Paulsen, you're recognized.
Thank you, Mr. Chairman, and Dr. Price, I want to welcome you back to committee today. Dr. Price, as you know, my home state of Minnesota has a long history of being on the cutting edge of a lot of medical innovation. That's certainly true today. During the last year, I've had the opportunity to visit with several companies in Minnesota who are at the forefront of integrating technological advancements into healthcare delivery. One of those companies is Hypnosis that uses software as a service. They've become a disruptor in the telemedicine space by creating an online adaptive interview platform that improves patient outcomes and then drives down costs. Another company I went to, Novo Health, is using data-driven health incentives to help keep patients engaged in living a healthy lifestyle that reduces the long-term health complications. I've also visited with another new startup called Gravy Incorporated, which is building tailored benefits packages that employers and employees actually want to use. So these are three different companies doing very different things in the healthcare space, but what they have in common are two things. First, they're all harnessing that power of technology and innovation to build a better healthcare delivery model that has the potential to provide better outcomes for patients and at the same time drive down costs. And then secondly, during my visits with each of them, they all highlighted current regulatory barriers that have stood in the way of their progress. So Dr. Price, what are some of the things that you think HHS will now be working on specifically in the innovation space to create that regulatory environment that protects patients and taxpayer resources, but also allows innovative companies like Hypnosis and Novo Health and Gravy to thrive?
This is an incredibly important issue because when I have talked to my former medical colleagues about the cutting-edge kinds of things that are out there, many of them will actually say that they no longer look to the United States companies to see what's actually pushing the envelope. They're looking to companies overseas because of the kind of regulatory barriers that are in place or have been put in place, most often by the federal government. So I'm so thrilled that Scott Gottlieb has been confirmed at FDA, because FDA is the entity that looks at so many of these devices and innovations and provides for a streamlined fashion for them to come to market. And I've charged him, the President's charged him with absolutely committed to having an accelerated pace to get safe devices, safe innovations to market so that patients are able to benefit. But there are regulatory hurdles. There are hurdles in terms of reporting requirements. There are hurdles in terms of just the timeline that it takes to be able to put in place a proposal and gain the feedback that's necessary from the federal government. We're going to do all that we can to make certain that the United States once again becomes the leader in the world when it comes to medical innovation.
Thank you, Dr. Price.
Thank you. Mr. Blumenauer, you're recognized.